Hello and welcome to Speak Up, Listen Up, Follow Up, the podcast from the National Guardian's Office. In this series, we'll be exploring the role leaders play in fostering a healthy speaking up culture and making speaking up business as usual. In our first episode, Dr Jayne Chidgey-Clark, National Guardian for the NHS, speaks to Dr Navina Evans CBE, Chief Executive of Health Education England. The National Guardian's Office, in collaboration with Health Education England, has recently launched final module in the Freedom to Speak Up e-learning package. This module provides senior leaders throughout healthcare with an opportunity to reflect on the influence they have in shaping the speak up culture in their organisations. In this conversation, Navina speaks candidly about her own experience of speaking up, her plans to be the best place to work, and why listeners should check out the new training package.
These things happen, we need to know, and if we are in the mindset that we're always looking to improve, then we can be curious.
We hope you enjoy this insightful conversation. And now, over to...
Well, Navina, thank you so much and welcome to our National Guardian Office podcast, Speak Up, Listen Up, Follow Up. And I wonder if my first question, I can ask you what speaking up means to you.
Hello, Jayne. Thank you so much for having me. Hello, Jayne. Thank you so much for having me. I really appreciate this opportunity to share and be part of this series. Speaking up is something that's really important to me, actually. And I remember when the whole sort of movement, if you like, in a senior leadership position, I didn't quite realize how welcome it would be. I didn't quite, you don't know what you don't have, or you don't miss what you don't have. You know that saying?
Yeah.
And I suddenly realized that it was such an important kind of additional source of information to help me to do my job as a leader really well. So I am really grateful for it, the whole speaking up culture and movement.
That's brilliant, thank you. And within Freedom for all workers to be able to raise any matter that gets in the way of them doing their job, not necessarily to a Freedom to Speak Up Guardian, it could be to human resources, it could be to their line manager, it could be to patient safety, there are, and the Freedom to Speak Up Guardian route is an additional route, a very important now part of that overall culture. But for you, either whether it was before Freedom to Speak Up Guardians were introduced or after, have you had experience of either speaking up yourself about something that was important to you, or someone in your organisation speaking up to you, and what was that like?
Yeah, both actually. So actually myself, and I recall feeling really scared and nervous, and almost like rehearsing it, time over and time again, thinking, how am I going to say it? And then actually feeling a huge sense of relief when it was received well, and when people sort of listened and thought about having, what shall we do about something, and there were no kind of adverse consequences. But I also have had the experience of not speaking up because I was afraid to, or I was reluctant to, because I felt that this was when I was already a junior doctor and I didn't speak up. And I felt that actually I had the power. I felt a bit of a coward at not having to do that. And I still remember that. And I think that's one of the reasons why I feel I really want to make sure that people do feel they can. And then when people have spoken up to me, I've never been a guardian, a Freedom to Speak Up guardian, but obviously I've been in a position where, people do raise their concerns. And three reactions, I think. One, I felt grateful, because the times that people have told me things, I sort of thought, oh my goodness, I know the situation, but I never thought of that. So that was really good to know. The second was I felt relieved that I worked in a culture where I know that that isn't always the case. So when people can, that felt really. And then the third thing was actually making a decision that you're going to fix something, and that could take a while, but there were steps. There was always there's always a way to make it better. So yeah, so that's how I think it's impacted on me and my work.
Wow, that's so helpful. Thank you. And I think what the description you described when you were working as a junior doctor and you didn't speak up, I'm glad you had, a positive experience, but then to have that experience where you didn't feel safe to do so, the NHS, I'm glad you had, a positive experience, but then to have that experience where you didn't feel safe to do so, the NHS staff survey and our recent Freedom to Speak Up survey of Guardians still tell us that there are too many people, too many workers that feel it's not safe to speak, something bad happening to them, or because they feel that nothing's going to happen, and that fear of futility, and that's something that still is very prominent for some people. And that sort of brings me to feeling so passionate about the role of leaders within the NHS. And that's not just the most senior leaders, it's also leaders at all levels. There's a culture that is safe and open and transparent where people can speak up. There will, you said it's a gift when someone, I heard you say, it's wow, thank you, when someone has spoken up to you. And that response that it is welcome, it will be taken seriously, will be looked at, acted upon, and so that leadership message is really important, and that's part of why we're undertaking these podcasts, to have these conversations with leaders. And I know that our office has worked with Health Education England to produce our training, and we've got 3 modules now. We've got the module for workers, we've got the one for Freedom to Speak Up, for sort of managers, what happens when people speak up, the next steps. And our third one that we've just published is the one for leaders. And I wonder, from your perspective, what do you think are the key takeaways for that third module for leaders, as we're talking hopefully to leaders today? Hopefully to leaders today.
So I think the thing about leaders is that you take it really personally about your organization or your directorate or your team, whatever level you're at, right? So a leader feels really organization, let's call it that. And so sometimes you feel terribly wounded when you hear something. And I feel like that now. I felt like that in my old organization. You work so hard to make things better, and then something happens and you think, oh no, that's happening in my on my watch. And you do feel really wounded, and you take it really personally. So I think for me, the switch I made in my mind was actually just accepting that there's thousands and thousands of interactions that happen, every single day. People under stress, people come to work to do a good job, the processes, the demands, the whatever. We're all vulnerable, we're all fallible, I suppose. And just to think, these things happen in the mindset that we're always looking to improve, then we can be curious, and then we can hear things, then we can feel uncomfortable, and we can use that discomfort and that curiosity towards improvement, and maybe then not fall into denial or attack or something else, but actually sit with the discomfort, sit with the pain sometimes, and then be spurred on to make it better.
Yeah, that's such a helpful message, and a bit of a synopsis of some of the information that's in what is quite a short, bite-sized piece of training for leaders. And we're really encouraging all leaders at different levels, and including very senior leaders in organisations, to undertake that training. And I just wonder whether that's something that you're going to be encouraging leadership within Health Education England, because you have your own Freedom to Speak Up Guardian system for your own workers to speak up, as well as what you're doing for students out in the system. So I just wondered what you're going to be doing as a board both with the training and when the new national policy for freedom to speak up is published shortly.
So absolutely. So in Health Education England, one of the things that we keep, so, that's really important. We can't expect others to do stuff that we don't do ourselves. And we also have to, we need to just be okay about the fact that we will sometimes get it wrong.
Yeah.
So this is really important. In fact, I believe at the last board meeting, we had our annual report on some of the themes that are emerging for our staff, because not focusing so much on our trainees and students. We look after them, but we also need to look after our staff. So absolutely, we've got to understand how we respond, our systems and processes, our own leadership behaviours as very senior people, because people watch us to see how we behave, when concerns are raised, and it's really important that we do so in an open way, and be upfront when we get it wrong. Be upfront when we get it wrong. I think that's really important.
Absolutely, Navina. Thank you for your honesty there, because you're absolutely right. If we can't acknowledge we've made mistakes and we're going to learn from them, and we can't role model that, then as national bodies, then we're not going to be helping people with this culture themselves, and that's so important. Thank you for that. I was just wondering, in terms of within Health Education England itself, what sort of steps you're taking to integrate that positive, open culture that all your staff will feel safe to speak up. Are there any particular ways to look at how you're including some of those harder to hear voices, be that people with a disability, be that workers who come from a Black and minority ethnic background that we know research says find it harder to speak up in all sorts of organisations. So are there anything particular things that you're doing?
Yeah, so it's under the umbrella of what we call making HE the best place to work, which is quite ambitious. And this started just before I joined HE, actually. And there are probably there are three strands that I would pick out in this. One is listening. Listening is really, really important. Listening is really, really important. So we've used a number of different ways of listening. We engage with a partner to help us use a sort of crowdsourcing kind of platform to get people's views. And there's some really moving, some lovely. The thing what amazes me is there's some wonderful examples in one another, and then there are also those stories which are completely the opposite, which is really quite sad, So that's that. Then making sure that our staff networks properly do what networks are supposed to do, which is to give a voice, to our colleagues with or networks that our staff have themselves decided to raise themselves. We've got the guardians, and then we've got our other sources of data and information, and then our action plans that we put into place to try and address the concerns that people raise, and then communicating back to people what we've done, and also communicating, we've done some things and it hasn't shifted, it isn't working, we need to go back and look at, maybe that's not the right intervention, what do we have to try and do differently. And most recently, I think for our BME colleagues and for our colleagues with disability, some of them have reported that actually in some areas things have gotten worse for them during the hybrid working time, return to the office. Actually, in some areas things are getting more difficult. So that's hard to hear, but really important that they tell us that. So it's sort of gathering information from different sources to contribute to our plan. And the final thing I'll say is that we have it's taken very seriously at our board level. So our non-executive directors on the board and our chair, it's really important. And we have a board committee, which is our people and culture committee, where they really, really scrutinise and a lot of assurance in quite a robust way.
Yeah, and that's so important, isn't it? And what there's a lot you've packed into there, and I shall look forward to listening back to this. But one of the things that came out is that curiosity. You used the word curiosity, and how that's so important as leaders to be curious about what people are telling you. And I don't know about you, but I also think what people aren't telling you, listen for the silence, and that may be silence within certain groups, or it may be silence about certain matters, and it's how then as a leader we seek to draw that out, so we do make sure that we're not missing, and we've got big gaps in our knowledge about what's getting. You say people come to work to do a great job, and how important it is that we facilitate that. That's so helpful. Thank you so much, Navina. Can I ask you next, in terms of that leadership training package for Freedom to Speak Up that we've co-produced together, have you got plans for using it within your organisation yourself?
Yes, thank you, Jayne. Yes, absolutely. We will, as a board, we will be all doing the follow-up training, and I think it'd be really good for us also to give feedback to our teams that have developed it and what it feels like training ourselves, and therefore understand what it feels like for other senior leaders and other board members, and across the system to do for them to do the training. So definitely look forward to doing the training myself. And I think that encouraging others, you can encourage others to do the training if you have done it yourself. So it's more real.
It comes back to that walking the talk that you said, doesn't it?
Exactly.
And I think for me, one of my really big hopes is that it's a short, sharp piece of training. It's not complex, but that it will be a conversation starter used alongside the policy that they'll be bringing out for Freedom to Speak Up shortly. That leadership within organisations will be using it as an opportunity to reset. What are we doing well? What are we not doing so well? What do we need to do more of? And it can inform that. That's my real hope. A conversation starter. Brilliant. I'm just going to ask you a final question, if I may, Navina, and that's regarding, do you have yourself a Speak Up pledge that you'd like to leave our listeners with?
Yes. So for me personally, Jayne, I always worry about being not being close enough to the point of care. And I think the further away you get the point of care, and when you're in an arm's length body like me, I think it's probably the furthest you can get from the point of care. It is so important to work really hard at maintaining that connection to the people we serve. And speaking up is such an important place to do that, and a means of doing that, of staying connected to the point of care. So my pledge is, when I hear about things that come up through the Speak Up route, to really try and connect the meaning of that to what is actually happening right there, where people come in contact with health and care services.
Navina, thank you so much. That's a brilliant place to end, and thank you for all you're doing with the culture for speaking up in the NHS. Thank you.
Thank you. Thank you.
Thank you so much, Navina, for taking the time to come on our podcast. Thank you for listening. I hope you enjoyed this episode. Next time, Jayne will be joined by the National Director of Community Health at NHS England and the Chief Executive of Cambridgeshire Community Services NHS Trust, Matthew Wynne.
Without a good culture where staff are supported, we are in a hide into nothing.
Make sure you're subscribed so you never miss an episode, and we welcome your feedback, so please like, rate and comment. Thanks again for listening.